a day on the 36th annual science festival which start, Generally, given to conduct one science festival for 1 month, 31 days, it may be very difficult. The Bangalore Science Farm has completed 35 years and now it is 36 years. The detailed record this science farm was started in 1962 by Dr. Organizers on those days. Even his colleagues used to make fun of him, what is this science farm would become? Only 4 or 5 people used to come. But the clear objective of popularizing science and the idea was to conduct one lecture every Wednesday science lecture. Just imagine, started in 1962, a Wednesday. No date, no year, no month. Even after 51 years, I don't think I let off a single Wednesday. That is the not even a single one. And as for the popular science lecture weekly is concerned, it is only day important, not the date, not the month, not the year. But the science festival is concerned, it is for July to 31st July is important. Whereas the year is not important, 36 years over, I think 50, 60, 100 years, I think will continue. What is past will always projected in the future. Apart from that, one year we have to just remember now we quoted a music program about 1976, 77 like that. Or if you go music program, music festival, Raman Usvam Ganesh Usvam Sanjan Usvam ನಾನು ಹೇಳಿದ್ರೆ ಏನು ಆಗ್ತದೆ ಅಂದರೆ ಸರ್ ಮಾಡೋದು ಅಂತ ಅದಲ್ಲ ಇಟ್ಸ್ ನಾಟ್ ಎ ಪಾಯಿಂಟ್ ವಾಟ್ ಐ ಆಮ್ ಆಸ್ಕಿಂಗ್ ಬಟ್ ಒಬ್ರು ವಿಜ್ಞಾನಕ್ಕೆ ಗಮನ ಕೊಡೋದಿಲ್ಲ ಮಾಡಿ ಸರ್ ಇದಲ್ಲ ಮಾಡೋಣ ಅದಕ್ಕೆ ಆಗಲ್ಲಪ್ಪ ಆಲ್ಮೋಸ್ಟ್ ಹ್ಯಾಡ್ ಮಾಡ್ಕೊ ಹಾಗೆ ವಿಜ್ಞಾನೋತ್ಸವ ಮಾಡಬೇಕು ಸೈನ್ಸ್ ಫೆಸ್ಟಿವಲ್ ಅಂತ I think remarkable. Perhaps before 1978, if somebody shows me somewhere 70, 60, 40, somebody does that point science festival, I am very happy to know it, at least according to my full knowledge, it was first Nastimaya of point science festival, the day on which he point science festival, and it's coming here, and also more in the future. Our science festival open Madaga, it's the idea of Kundana. Now, one lecture on the understand, on that day, lecture on 15 ದಿನ ಜನಗಳಿಗೆ ಎಷ್ಟು ಕಷ್ಟ ಲೆಕ್ಕಾಪಡೆ ಒಂದು 10 ಫೋನ್ ಕಾಲ್ಸ್ into 15 ಅಥವಾ ಅವಾಗ ಇಷ್ಟೊಂದು ಫೋನ್ ಇರಲಿಲ್ಲ ಆ ಹುಡುಗರೇ ಕಟ್ಟಾಗ್ತಾರೆ 15 ದಿನ ಮುಗಿಸ್ಬಿಟ್ಟು ಸರಿ ಫೆಸ್ಟಿವಲ್ ವ್ಯವಸ್ಥೆ ಮಾಡೋಣ ಅವರ ವ್ಯವಸ್ಥೆ ಮಾಡೋಣಪ್ಪ 15 ಡೇಸ್ ಇದ್ದರು ಮಾಡ್ಬೋದು ಸಕ್ಸಸ್ಫುಲ್ ಮಾಡ್ಬೋದು ಅದಾದ ತಕ್ಷಣ ಅನ್ಸೋಸದಿಂದ ಕಟ್ಬಿಟ್ಟು ಅಪ್ಪ ಏನ್ ಸರ್ ಒಂದು ಸತಿ ಆಯ್ತು ಬಟ್ ಇನ್ನೊಂದು ಸತಿ ಮಾಡಿ ಕ್ಲಾರಿಟಿ ಕೊಟ್ಬೇಡ ಇದಕ್ಕೆ ಡಬಲ್ ಮಾಡೋಣ 30 ದಿನ ಬಂದ್ಬಿಟ್ಟು ಸರಿ ಸರ್ ಅಂತಾರೆ 30 ದಿನ ಮಾಡ್ಬೋದು ನೆಕ್ಸ್ಟ್ ಟೈಮ್ ಕಷ್ಟ ಆಗಿತ್ತು 30 ದಿನ ಆಮೇಲೆ ತುಂಬಾ ಇನ್ನೊಂದು ವರ್ಷ ಮಾಡೋದು ಇನ್ನೊಂದು ವರ್ಷ ಅನ್ಕೊಂಡು ಕೂತು ಒಂದು ಫೋನ್ ಅದೇ ಈ ಮಾಡ್ಕೊಂಡ್ಬಂತೀವಿ ಅಂತ 31 ಸ್ಪೀಕರ್ಸ್ ಫಿಕ್ಸ್ ಮಾಡುವಾಗ ಅಟ್ಲೀಸ್ಟ್ ದಿ ಫಸ್ಟ್ ಸ್ಪೀಕರ್ ಕಾಂಟ್ಯಾಕ್ಟ್ ಮಂತ್ ಬ್ಯಾಕ್ ಅಲ್ಲಿ 2 months ಬ್ಯಾಕ್ ಅವ್ರು ಒಪ್ಕೊಂಡಿರ್ತಾರೆ ಡೆಫಿನೆಟ್ ಆಗಿ ಇಂಟ್ರೆಸ್ಟ್ ಅವ್ರಿಗೆ ಪ್ರಾಬ್ಲಮ್ ಅಂದ್ರೆ ಅವ್ರು ಸಾಲ್ವ್ ದಿಸ್ ಪ್ರಾಬ್ಲಮ್ ಅವ್ರಿಗೆ ಕಷ್ಟ ಆಗುತ್ತೆ ಎಲ್ಲ ಬೇಕಾದ ಪ್ರಾಬ್ಲಮ್ಸ್ ಇದೆ ಅಂತದ್ರೂ ನಮ್ಗೇನ್ ಪ್ರಾಬ್ಲಮ್ಸ್ ಅರ್ಥ ಆಗೋದಿಲ್ಲ ಎಲ್ಲೋ 1 or 2 ಬಂದಿರೋ ಅಂತ ಆ ಸಾಮಾನ್ಯ ಇಸ್ರೋ ಯಾರು ಒಪ್ಕೊಂಡಿದ್ದಾರೆ ಎಕ್ಸಾಕ್ಟ್ಲಿ ಜುಲೈ ಮತ್ತೆ ಲಾಸ್ಟ್ ಬರುತ್ತೆ ಇಫ್ ಶಿವಕುಮಾರ್ ಅವರು ಅದೇ ಹೇಳಿದ್ರು 24th ನೈಟ್ ಬರ್ತಾ ಇದ್ದೀನಿ 25th ಕೊಡ್ತಾರೆ ಆಗ ಬೇಡ ಸಂಡೇ ಕೊಡಿದ್ದಾರೆ ಬಟ್ ಅವ್ರು ಹೇಳಿದ್ರು ಏನೋ ನೀವು ಬಲವಂತ ಮಾಡ್ತಾ ಒಪ್ಕೊಂಡ್ಬಿಟ್ಟು ಅವ್ರು ಆಗಿತ್ತು ಗೊತ್ತಿಲ್ಲ ಅವರು ಸ್ವಲ್ಪ ಇದೆ ಅಂತ ಹೇಳೋದು ಹೇಳಿದ್ರು ಬಟ್ ಹಾಗೆ ಹೋದ ವರ್ಷ ಹೇಳಿದ್ರು ಅದು ಹೋದ ವರ್ಷ ಹೇಳಿದ್ರು ನಾನು ಅಮೆರಿಕಾದ ಇಮೇಲ್ ಕಳಿಸಿದ್ರು ಚೇಂಜ್ ಮಾಡಿಲ್ಲ ಕೊನೆ ಕೊಟ್ಟಿದ್ದಾರೆ ಲೆಕ್ಚರ್ ಆಮೇಲೆ ಡಾಕ್ಟರ್ ಬಲರಾಮ್ ಅವರು ವಿಚಾರ ಬಂದಾಗ he is a top-class, brilliant scientist in our country, the director of English. ಅದೆಲ್ಲ ನಿಮ್ಗೆ ಗೊತ್ತಿದೆ ಬಟ್ ಇನ್ನೊಂದು ನಮ್ಮ ಪಾಯಿಂಟ್ ನ್ಯಾಷನಲ್ ಕಾಲೇಜ್ ಪಾಯಿಂಟ್ ಕೇಳಿದ್ರೆ he has never refused any request by the national college. ಯಾವ ಸಮಯದಲ್ಲಿ ಏನಾಗಿ ಕೇಳಿದೆ ಅದರ ಸೈನ್ಸ್ ಫಾರ್ಮ್ ನಲ್ಲಿ ನಂಬರ್ ಟೋಟಲ್ ನಂಬರ್ ಆಫ್ ಲೆಕ್ಚರ್ಸ್ ಯಾರು ಕೊಟ್ಟಿದ್ದಾನೆ ನಾವು ಬ್ರೈಕ್ ಇಟ್ರೆ he deserves the gold cup of an interesting clue. And Dr. Balaram, you are instrumental in getting 2 Nobel laureates, Dr. P.Balaram and also Dr.P.Balaram. And his field is a bachelor's degree in chemistry from Ferguson College, University of Pune, followed by a master's degree in the Institute of Technology, Bangalore, and a PhD degree from Carnegie Mellon University with Axel A. partnered by. After a postdoctoral stint at Harvard University with Nobel laureate Robert Burns. He returned to the Indian Institute of Science, where he has been ever since the faculty member in the molecular biophysics unit. And he joined as lecturer, assistant professor, chairman of different departments, director, Indian Institute of Science. During his PhD, Balaram studied the use of negative nuclear overall effect signals as proofs of macromolecular conformations. ಇಷ್ಟು ಹೇಳಿದಾಗ ಯಾರೋ ಒಂದು 4 ದಿನ ಕಷ್ಟ ಆಗ್ಬೋದು ಅಂತ ಕಾಣುತ್ತೆ. ಅಷ್ಟು ಇಂಪಾರ್ಟೆಂಟ್ ಅಲ್ಲ. ನೆಕ್ಸ್ಟ್ ಸಬ್ಜೆಕ್ಟ್ ಇಂಪಾರ್ಟೆಂಟ್, ಬಟ್ ಅದರ್ ಪಾಯಿಂಟ್ ಆಫ್ ಇಲ್ಲ. ಬಟ್ ನೆಕ್ಸ್ಟ್ ಒನ್ ಎಲ್ಲರೂ ಗೊತ್ತಾಗುತ್ತೆ. As a postdoctoral with Glivec, Balaram worked on the synthesis of antibiotic erythromycin. ಮಕ್ಕಳಿಗೆ ಕಾಯಿಲೆ, ದೊಡ್ಡವ್ರ ಕಾಯಿಲೆ, ಯಾವ ಡಾಕ್ಟರ್ erythromycin is not such a popular medicine, and such a distinguished person is here. And the main area of research has been investigation of the structure, conformation, and biological activity of design and natural peptides. To do this, he has extensively used techniques such as nuclear magnetic resonance spectroscopy, infrared spectroscopy, and circular diachroism, along with X-ray spectroscopy. He has been a major contributor to the evolution of factors influencing the folding and conformation of design peptides, and has investigated structural elements playing a key role in the formation of secondary structural motifs such as helices, beta-lens, and sheets. Along with Isabella Corley, a frequent collaborator, he also pioneered the use of alpha-amino isobutyric acid to induce and retain helicity and constrain peptide conformations. He has authored more than 400 papers and is a fellow of the Indian National Science Academy. He was also a colleague of late Professor G. L. Ramchandran at the Molecular Biophysics Institute of Indian Institute of Science. He is presently the director of the institute, as you know, and also has received almost all awards. Because of what there, but most important is Padma Awards. He is research into the Padma Awards. ಇದೆಲ್ಲ ಆದ್ಮೇಲೆ ನಮಗೆ ಸಂತೋಷ ಅಂದ್ರೆ ಆನ್ ದಿಸ್ ಡೇ ನಾವೆಲ್ಲ ಫಿಸಿಕ್ಸ್ ಸಾಮಾನ್ಯವಾಗಿ ನಾವು ಫಿಸಿಕ್ಸ್ ಇಂಪಾರ್ಟೆಂಟ್ ಬೇಕಾಗ್ತದೆ ಅನ್ಕೊಂಡಿದ್ವು ಅಂದ್ರೆ ಆಮೇಲೆ ಸಡನ್ಲಿ ಕೆಮಿಸ್ಟ್ರಿ ಬಯಾಲಜಿ ಎಲ್ಲ ಬಂತು. ನಾನು ಪ್ರಮಾಣ ಮಾಡ್ತಾ ಇದ್ದೆ ಆಲ್ ಗೋಸ್ ಫಿಸಿಕ್ಸ್ ಬಯಾಲಜಿ ಅಂತ. ಇವತ್ತು ಇನ್ನೊಂದು ರೋ ಓಪನ್ ಮಾಡಿದ್ದಾರೆ ಅವರು ಏನಿರ್ತದೆ ಕೆಮಿಸ್ಟ್ರಿ ಬಯಾಲಜಿ ಅಂತ interestingly, and that was the current topic, lessons from the Glivec case. And on such an occasion, so many distinguished people are here. Professor Mahabharat and Professor Mahabharat, yaar mention ಮಾಡಕೊಂಡ್ರೆ ಅವ್ರು ಬೇಕಾದ್ರೆ ಇದು ಫೌಂಡರ್ ಪ್ರೆಸಿಡೆಂಟ್ ಕಂಪ್ಯೂಟರ್ ಸೊಸೈಟಿ ಎಲ್ಲ ಬಿಟ್ಕೋಣ IIT ಕಾಂಪೌಂಡ್ ನಮ್ಮ ಕಾಲೇಜ್ ಕಾಂಪೌಂಡ್ ಮೇಲೆ ಇದೇ ಕಾಂಪೌಂಡ್ ಓದ್ತಾರೆ so many and also he was professor at MIT, distinct professor. He was not actually. Like Dr. student, and he was student in the same college. He was in a ನಾನು ಇಷ್ಟು ಸಂತೋಷ ಬರ್ತಾರೆ ಗೊತ್ತಿರೋ ಒಂದು ಲೆಕ್ಚರ್ ಕೇಳ್ತಾ ಇದ್ದೆ. ಇವಾಗ ಲೆಕ್ಚರ್ ಕೊಡ್ತಾರೆ ಸರ್ ನೆಕ್ಸ್ಟ್ ಇಯರ್ ಲೆಕ್ಚರ್ ಲಾಸ್ಟ್ ಲೆಕ್ಚರ್ ಕೊಟ್ಟಿದ್ದು how your grandmother will cook in India when you are 13 years in Africa. That was a very good lecture. ನಾನು all of you ನಾನು ಡಿಸ್ಟರ್ಬ್ ಮಾಡೋಣ ಅಂದ್ರೆ ಇವಾಗ ನೋಡೋಕೆ ಕೇಳಬೇಕು ಅನ್ಸುತ್ತೆ. ಆಮೇಲೆ ಡಾಕ್ಟರ್ ನಾಗಭೂಷಣ್ ಕೂತಿದ್ದಾರೆ. ಇವಾಗ ಅಲ್ಲಿ ಡೈರೆಕ್ಟರ್ ಆಫ್ ನ್ಯಾಷನಲ್ ಏನಾಗ್ತದೆ ಲಾಬೊರೇಟರಿ. ಅದಕ್ಕಿಂತ ಅಫ್ಸನ್ ಪ್ರೊಫೆಸರ್ ಪ್ರಭು ಅವ್ರ ವಿಚಾರ ಇವರು ಗೊತ್ತೆ ಡಾಕ್ಟರ್ ಬಲರಾಮ್ ಅವರಿಗೆ ಅವ್ರು ಲಿಸ್ಟ್ ಮಾಡಿರ್ತಕ್ಕಂಥದ್ದೆಲ್ಲ ಟೋಟಲ್ ಆಗಿ ಅವ್ರದ್ದು ಇದೇ ಹೋಗುದು ನ್ಯಾಷನಲ್ ಕಾಲೇಜ್. ಈಗ ವೆರಿ ಡಿಸ್ಟಿಂಗ್ವಿಶ್ಡ್ ಪರ್ಸನ್ಸ್ ಅದೇ ಅವ್ರಿಗೆಲ್ಲರಿಗೂ ವೆಲ್ಕಮ್ ಮಾಡಿ ಬೇಕಾದ ಸ್ಪಾನ್ಸರ್ ಮಾಡಿದೆ ಡಿಫ್ರೆಂಟ್ ಲೆಕ್ಚರ್ಸ್ ನ ಅವ್ರನ್ನ ವೆಲ್ಕಮ್ ಮಾಡಿದೆ. ನನಗಂತೂ ತುಂಬಾ ಸಂತೋಷ ಆಗುತ್ತೆ ಟೋಟಲ್ ಆಗಿ. ನಮ್ಮ ನ್ಯಾಷನಲ್ ಕಾಲೇಜ್ ಇನ್ಫ್ಯಾಕ್ಟ್ ಪ್ರಜಾವಣಿ ಏನ್ ಮಾಡಿದ್ರು ಬ್ಯಾಂಗ್ಳೂರ್ ಸೇರ್ಕೊಂಡು ಅಂತ ಇರೋರು ನ್ಯಾಷನಲ್ ಕಾಲೇಜಿನಲ್ಲಿ ವಿಜ್ಞಾನೋತ್ಸವದ 36 ಸಂಭ್ರಮ ಅಂತ ಹೇಳ್ತಾರೆ ನ್ಯಾಷನಲ್ ಕಾಲೇಜಿನಲ್ಲಿ. ನಾನು ತಮಾಷೆ ಮಾಡಿದೆ ಬ್ಯಾಂಗ್ಳೂರ್ ಸೇರ್ ಮಾಡ್ಬಿಡ್ತಿದೆ ಅಂತ ಎರಡು ಒಂದೇ ಹೋಗಿಸ್ತಾ ಇದ್ದಾರೆ ಒಳ್ಳೆ ಆಗ್ತಾರೆ ಬ್ಯಾಂಗ್ಳೂರ್ ಸೇರ್ ಅದರ ಬಿಟ್ಕೋಣ. ಟೋಟಲ್ ನ್ಯಾಷನಲ್ ಕಾಲೇಜಲ್ಲಿ ವಿಜ್ಞಾನೋತ್ಸವ ಯಾವ್ದಂದ್ರೆ 36 ಸಂಭ್ರಮ ಅಂತ ಇದೆಲ್ಲ ಕಾಣಿಸ್ಕೊಂಡಾಗ ಅದು ಐ ಥಿಂಕ್ ಕೆಲವೊಂದು ಲಾಂಗ್ ಅಕೌಂಟ್ ಮಾಡಿದ್ದೀನಿ. ಯಾಕೆ ಮಾಡಿದ್ದೀನಿ ಅಂತಂದ್ರೆ ಸ್ವಲ್ಪ ಫಿಲಪ್ ಆಗಿದೆ ಬಟ್ ಇವತ್ತು ಮಾಡಬೇಕಾಗಿಲ್ಲ. ನಾನು ಹಿಂಗ್ ಹೋದಾಗ ಎಲ್ಲೂ ಇಲ್ಲ ಅಂತ ಕಾಣ್ತಿದ್ದೆ ಜಾಗ ಕಂಪ್ಲೀಟ್ಲಿ ಮನ್ನಾಡು ಆಚೆ ಕಾಣ್ತಿದ್ದಾರೆ. ಅಂಡ್ ದಟ್ ಇಂಡಿಕೇಟ್ಸ್ ಡಾಕ್ಟರ್ ಬಲರಾಮ್ ಬಲರಾಮ್ ಬಂದ್ರೆ ನಮ್ಮ ಕಾಲೇಜ್ ಸ್ಟೇಜ್ ಮುಂದೆ ಕೊಡೋಗುತ್ತೆ. ಅಂಡ್ ಅಗೇನ್ ಎಕ್ಸ್ಪ್ಲೇನ್ ವೆರಿ ವಾಲ್ ವೆಲ್ಕಮ್ ಅಂಡ್ ರಿಕ್ವೆಸ್ಟ್ ಟು ಇನಾಗ್ರೇಟ್ ಸೈನ್ಸ್. And the molecule structure is there.
and it is a drug which is used for a specific type of leukemia called chronic myelogenous leukemia. The drug is sold by Novartis, which is a multinational pharmaceutical company, and the patients have to pay 1,20,000 rupees per month for the drug. It's also sold as a generic by Natco Pharma, and the patients have to pay 8,000 rupees a month. So there is obviously now a problem when India's patent laws were amended some years ago. Can Glivec now be patented in India or not? And the first ruling was that Glivec cannot be patented in India because as the law was framed, the Glivec patent had already been filed many years earlier in the United States, and therefore it was no longer valid in India at the time that the new patent laws went into force in 2005. Novartis, as a company, then decided that they would now file a patent for a new form of this drug and thereby prevent the generic manufacturers from manufacturing the cheaper version of the drug. This case went to the Madras High Court, and the Madras High Court then some years ago ruled against Novartis and said that this was not possible. Novartis then filed a case in the Supreme Court, and it took some time before the Supreme Court actually heard the case. And the Supreme Court heard the case for quite some time, and on the 1st of April this year, they ruled against Novartis and said that the Glivec new form patent was not admissible in India. This was a verdict of the Supreme Court which was welcomed by patients, by their families, by many groups across the world, across India and across the world. But it was immediately criticized by Novartis, saying that this is now going to dampen the enthusiasm for research in India. Therefore, when I first read about this in the newspapers in April, I was quite intrigued by what this case was all about. And this was the first time that I actually downloaded an entire Supreme Court judgment and then I read it. When I read this judgment, my respect for the judges of the Supreme Court went up very much because the judgment was an extremely well-reasoned judgment and it contained a great deal of science. In fact, it contained, I think, a lot more science than it contained law. And I thought, therefore, I should then try to explain to you this evening something about the science behind Glivec, something about the law behind the Glivec case, and what is it that we have learned from this case. This happened in April. We are now only 2 or 3 months away, and therefore what have we learned? The principal scientist in this is Brian Drucker, who actually really did all the basic science that was necessary to make Glivec into a drug. The subsequent development was taken up by Novartis as a company. Now I borrowed this slide from a set of lectures on medicinal chemistry given in the Swiss Federal Institute of Technology. I have 3 borrowed slides. All the other slides are actually made myself. The borrowed slides are in blue. The rest of the slides will be in other colors. And maybe there's one more for which I will give a reference. But this summarizes this new molecule and this new treatment. It entered the market. It was the first kinase inhibitor to enter the market. I will tell you what a kinase is and what we mean by a kinase inhibitor in a moment. It targets a genetic abnormality which underlies this disease, chronic myeloid leukemia. But the most important thing about this molecule is, and you will see why, from the day the first clinical trial was done to the day the Food and Drug Administration approved it was only about a couple of years. And from the time the application was filed in the Food and Drug Administration of the United States, the time to clearance was only 2.5 months. And therefore you can see there would have been enormous public pressure to introduce this drug into the market, and I will show you why this public pressure was really there. But I'm going to return to the Supreme Court. This is the case. On the one side, it is Novartis, On the other side, of course, is the Union of India. What I found interesting is, it doesn't matter what the case is, the Union of India is always the respondent. And the only people I have found who are totally not bothered by court cases are the Union of India. So any government department is used to cases and they treat it very routinely. Cancer patients, aid association, and a company. There were lots of other interested parties in this case. This judgment delivered on April 1st, 2013 by Justice Dr.P.Balaram and Justice Ranjana Desai says this: in view of the findings that the patent product, the beta crystalline form of imatinib mesylate, fails in both the tests of invention and that you do not want, the cancer cells. The molecule itself will look like this if you look at the structure of the molecule using X-ray diffraction. So you can have a three-dimensional structure of this molecule, and you can now think of this as a machine which is now doing something that you don't want it to do. So the next question, if you want to stop this from happening, is how do you stop this machine? You must now inhibit this machine, and activity must be inhibited, appeared in the 1980s. Once that was done and the lead compound was identified in 1990, by February 2002, a drug was now approved for human use. It took a 12-year period. This is one of the shortest in the history of the modern drug industry. In every lecture that you give on biology, I have noticed, in every lecture, it doesn't matter if it's biology or physics, the front rows are significantly older than the back rows. Because in my institute, I've seen for years, the professors will sit in the front, the retired professors will sit right up in the front, and the students will sit right in the back. So it always turns out that all the older people are right up to the front at the beginning. And they will, most of them, except the ones who are lucky, will be taking a large number of medicines. As you grow older, the number of medicines that you take keep on increasing. Now, if you look at each one of the capsules that you're taking and ask what compound is it, when was this molecule discovered, when was it introduced as a drug, you will find that everything that you're taking is something from at least the 1960s or even before. And I'm going to show you some of those as we go along a little bit later. Very, very few molecules or new drugs have been introduced into the market in the last 20 years, even fewer in the last 10 years, and there will be even fewer in the next 10 years. This despite the fact that the disease burden is going on increasing. Because as people live longer and longer, a new set of diseases are beginning to be important. The neurodegenerative diseases, Alzheimer's, and a whole host of other dementias, which are now becoming a reality. Therefore, one must take, and as an individual, I believe everybody should take some time off to try and understand the dynamics of the pharmaceutical industry, the dynamics of healthcare, and the social consequences of the research which goes on in this area. This is fast, but to the average person, especially to a patient, 12 years will appear a long time. Most other drugs take between 15 and 20 years to reach the market. Tomorrow, if you are going to have a drug for a disease which does not have a drug today, for example, I'll tell you one, beta thalassemia, which does not have a drug. If you want a drug for beta thalassemia, it's quite likely that it may take another 20 years for a drug to be even thought about, because people have been trying for the last 30 years and they've had no success. So it is a very, very difficult area. This is the figure which Brian Drucker printed when he got a major medical award, the Lasker Award, a few years ago, and this is a remarkable graph. This is the overall survival rate % for patients with this disease, and this is a comparison of the new drug Gleevec with interferon, which was the drug which was available at that time at high cost, and the conventional chemotherapies which are now available generally in cancer hospitals, a large number of very, very toxic molecules which are used in cancer treatment. And you can see how dramatic this is. This axis is the time months after beginning treatment. This is the overall survival rate, and you can see now, if you have a graph that is shown like this, then every patient is going, and their families, are going to demand that this drug be immediately available for administration. So at this point, regulatory clearance by the Food and Drug Administration in the United States was very fast. I must also tell you here, regulatory clearance in India does not, for all practical purposes, exist for new molecules. Regulatory clearance by the Food and Drug Administration in the United States is generally the gold standard for introducing drugs into other countries, especially into the developing world. This is a picture which I put in the inset, which shows at a meeting of the Leukemia and Lymphoma Society in the United States, patients and their families actually celebrating the introduction of Glivec. Now the chemical reaction, and I won't worry, there will be many chemical structures on the slides that follow. And since I have taught chemistry for many, many years and I study chemistry myself, I must say that the one thing that I know, it doesn't matter whether you're in a scientific audience or whether you're in a general audience. Everybody loves to hate chemical structures. And therefore, you should not worry about them. There are two disciplines, chemistry on the one side and mathematics on the other, which have their own language. And if you don't know the language, then it's very difficult actually to make out what there is. So I think the easiest thing to do is to look at them as nice pictures. Occasionally you can ask the question, can you see a difference between one picture and the other? And if you can't do that, you actually have in fact learned the art of looking at chemical structures. But this is a chemical reaction which is just a group of atoms, which is now an extra phosphate group which is transferred from one molecule to the other. This transfer of one phosphorus with 4 oxygen atoms on it, which is a phosphate group, is what the biochemists call a kinase reaction. And therefore, the enzymes which do that are the kinases. What we now want to do is to stop this enzyme from doing this reaction because it is doing this in an uncontrolled way. In fact, you can think of it this way. As I was driving to National College, I realized that the one thing that we've done is we've had no control over the number of vehicles which proliferate on the road. We also have had no control over the number of buildings which we build and where we build them. So if you have unrestrained proliferation of anything, that is a cancer. What you see outside is an urban cancer about which you can't do anything. Here at least you will see a biological event about which you can do something. So you might think about the cancer metaphor with respect also to yourself. Now, what you need then is a biochemical assay in which you can study the reaction which this molecule carries out, and then you can add various substances to it and ask, is this reaction inhibited? Is it stopped? Then you can ask, what kind of molecule stops it? And it turned out, when Brian Drucker went with this problem to Novartis, like any good large company, they were not interested. It took a long time to persuade them to take some interest in the problem and carry this out. So this is the first molecule which actually showed some kind of activity, and this is what the medicinal chemists will call phenylaminopyrimidines. And since these showed some activity, they are what we call lead compounds. They now are the lead compounds for discovering better and better compounds by adding atoms, removing atoms, by changing the structure, and so on. But what should a good drug do? The ideal drug is one thing, which you should be able to swallow, and then it must do its business. Most molecules that you swallow, you assume that they are doing their business. Very often they don't. Sometimes you don't even know with today's drug adulteration that you're swallowing the right molecule. But very often it turns out fate helps you more than anything else. And this is what in clinical testing is called the placebo effect. So in a clinical trial, a set of patients will be given the real molecule, another set of patients will be given a tablet which contains nothing but harmless powder, and sometimes the placebo group will also feel very much better after they have taken the tablet. Even their headaches will disappear. So they must have potent activity, they must have good properties, and they must remain in the body. They must have metabolic stability as they go through your bloodstream to the different tissues which they must have. Oral bioavailability is very important. because you don't want to go to the hospital to have the drug infused into you through an intravenous drip. There must also be a lack of toxicity. Cancer drugs are very toxic. This is why you have the side effects in cancer chemotherapy. But at some time it turns out the life-threatening disease, it becomes a balance between mortality and accepting the effects of toxicity. That is a patient choice. Then there is technical feasibility. If the molecule is very, very expensive to make, the drug will be very expensive. So you must bring down the costs of the chemistry, the costs of the engineering which is necessary to produce it on a large scale and transport it from one phase to the other, store it for years. Because if you look at every drug that you take, you will find that there's an expiry date. You don't want drugs to expire very quickly. Sometimes you will find that something which are used for the eye will expire within 4 weeks of your opening the thing and using it once. Now you don't know whether to believe this or not. This is what the medicinal chemists call lead optimization. This is the structure that I showed you on the other slide and then now of course you will add a group to it. You can see it's become slightly bigger. This makes it better in cellular assays. Afterwards you can add another group to this. This prohibits activity against some other target which you don't want to take. Then you can have another group added which enhances the activity against the target that you want. And then eventually you will add a group which makes it more soluble so that you can have a tablet and you can now swallow it. So the molecule becomes slightly bigger, different groups are added. But here you can go back. A long time ago, more than 100 years ago, the German chemist Paul Ehrlich introduced chemotherapy into the literature. He introduced this with respect to the diseases which were common at that time and very widespread, diseases like syphilis and leprosy. And he used very toxic molecules, all of which contained arsenic in them. So that was the beginning of modern Western medicine. And Ehrlich called these magic bullets. And the magic bullets are the bullets which will find the right target and hit them. The difference here is between being a sniper with telescopic sights and hitting the target exactly where you want it, and the other is being the person with a shotgun with all kinds of things packed into the shotgun and then turning it around and indiscriminately hitting every target in sight. That is what medicinal chemists are really doing with molecules. They are hitting a target, it's a biological target, they are wanting high selectivity and high efficiency. Efficacy and selectivity are the two goals of the medicinal chemist. Eventually, molecules like Glivec appear. But once molecules like Glivec appear, don't worry about this because this is a very modern slide. This is a very modern slide which tells you the way technology goes. Now there are targets. But then I get the same kind of target. There will not be only one kinase in your body, but there will be 250 kinases. Because now we know the sequence of the human genome, we know all the kinases which are there in human beings. There will be maybe 250, 300, 500, I don't know the exact number. But they're all related to one another, and this kind of picture is what is called a dendrogram, which reflects a relationship. So something over there is quite different from something over here. But something over here is quite similar to something over there. So suppose you want to hit something very selectively, you would like these dots to be clustered. And the concentrations at which the big things work is very low compared to the concentrations at which the small dots work. Because you don't want to take much of a drug, because if you take too much, you will have toxicity, and your body will have to clear this. So good drugs have a high selectivity, they don't hit too many targets, and they work at very, very low concentration. Of course, you can see again that is Novartis, that is Bristol-Myers Squibb, and that is Pfizer. The molecules will all be slightly different from one another, they will look different, and this is what the Supreme Court judges sometimes are asked to rule on. Are the molecules sufficiently different? Is this now a new molecule? And I will come back to this in a moment. I just show you these molecules again, and sometimes there are these puzzles which children are asked to do. There will be 2 pictures, and you will be asked to spot the difference. One could use this also. There are 4 pictures here, and you could try and spot the difference. If you look at them carefully enough, some of your prejudices or fears against chemistry will slowly evaporate. It isn't really very difficult. And I must say, in this particular case, the Supreme Court judges have, over a period of time, been remarkably educated in the chemistry that they have understood, and they have been extremely sophisticated in the wording of their judgment. But there is a problem. After you have found a drug which actually fits into this machine and blocks it, nature has ways of changing the target. This is genetic mutation. And mutation happens all the time. Mutations happen spontaneously, and what happens is you develop resistance to all drugs. And in this particular case, you can see how clever biology is. In a little while, patients will develop resistance to Glivec because the site at which it is blocking, they will change it. These are remarkable feats of engineering. Unfortunately, this engineering, and Professor Balaram was here to tell this engineering is done without our knowing how it is done. It is done by Darwinian selection. The engineering which nature does in biology is not done with the principles of engineering, but it is done actually by random mutation and then Darwinian selection for fitness. And therefore, you have to be always alert to this problem also. And scientists have begun to understand this also. We now know, for example, all the mutations which have taken place, and new drugs are now being introduced as a generation after Glivec. So these are the kinds of studies that I thought that I would first introduce you to. And we can now ask, how much does the process of drug development cost? This, I should have put economics also into my title. And health economics is a subject of great importance to everybody because the costs of healthcare are going through the roof. All of us who are getting older and older have only one worry. Are we going to have enough money available to pay for maybe what is the last treatment that you need to have before the end? And this would appear to be an enormously terrible way of having spent a lifetime doing something else. There are 3 phase 2 trials which a drug has to clear. In this particular case before the FDA filing, which involved 1,028 patients. The average cost in these is about $23,752 per patient. So it's a very large cost for carrying out clinical trials. But without going into the details, this is taken from this website on which all these details appeared shortly after the Supreme Court judgment. This is an American website, so everybody is interested all over the world in the Indian Supreme Court judgment on Glivec. Most of the references in this area are to this paper in the Journal of Health Economics, which actually estimates the general costs. But in the case of most drugs, this would be the cost at one item. The upper bound would be around $80 million. The lower bound, which is by the anti-pharmaceutical company people, would be about $34 million. We'll take the upper bound. $96 billion would be an upper bound, cost of capital, overheads. If you invested this much money and it took you 10 years to develop, how much interest would you have got without having invested the money in this process, and so forth. The Novartis sales for Glivec in 2012 was $4.675 billion or $390 million per month. So you can see the kinds of, if you have a successful drug, the kinds of profits that can in fact be made. But you must also temper this with one thought. The pharmaceutical companies also spend a lot of money on drugs which don't make it to the market, so you should not grudge them their profit entirely. But the real question is, what is a fair profit? That is a question that nobody has actually answered. And so there will be a discussion on this. But how was the research on Gleevec funded? How did we get to this stage? Almost 90% came from public sources, with only 10% having been funded by the company in the phase 1 clinical trial. So it turns out that if you look at the academic investments, they are all from public sources. It is the development costs which have really been borne by the company. So there is this cost of how much should you charge the patients for this trial. But this is a book review which appeared in the Journal of the American Medical Association by the editor of the journal in the year 2003. And he says Novartis was not the innovative force. Not only was all the basic research done in academic institutions, but so were the initial clinical investigations. It took a few years for Brian Drucker, the investigator most responsible for these data studies, to convince Novartis that it should invest in a cash program to develop Glivec and to undertake large-scale trials. So for the patients who are interested in this drug, it took quite a lot of effort on the part of the original researcher to push them into this. But while I was preparing for this lecture, which I did only over the last 3 or 4 days, it turned out that Saturday's version, in an edition of the Hindu, on its center page had this cartoon. And you must look at this cartoon. What it really suggests is that big pharmaceutical companies are milking the patient. Now, of course, you might also say that big corporate hospitals are also milking the patient. But then the other more subsidized hospitals, unfortunately, are not providing patients with the kind of ambience that they might require. But we will now return to another topic, which is very much discussed by common people. All of us discuss what happens in Parliament, and we have generally a rather poor opinion of Parliament. And Parliament doesn't function most of the time. But occasionally when it functions, most people are not inside the chamber where important legislation is being discussed. But this sometimes is a blessing in disguise, because the few people who are present inside the chamber then carry on a very informed discussion, and that happened in the Patents Bill, which was introduced in December of 2004, because India had international treaty obligations to begin the new patent regime from 1st January of 2005. Now this I have taken from the Supreme Court judgment, because the Supreme Court judgment quotes the Parliament debate. The opposition member tells the Speaker, sir, even if this were a bill which affects only India, still it would be an extremely important one. But it is a bill which affects most parts of the world. We are supplying 50% of the cheapest drugs in the world to places like Papua New Guinea, Laos, Kenya, Africa, etc. All these countries have complained to the World Health Organization about this bill. It is a bill that affects so many parts of the world. Do you not think we should have a slightly more serious discussion on it rather than attempting to pass it through? So he has some doubts on the bill. And he says, I'll read only the first one. We need to limit the scope of patentability only to new chemical entities. New chemical entities means that you must be able to read the chemical structure. If you read the chemical structure, you can ask, is it a new chemical entity or not? And very many problems come. Now, in response to what the opposition member raised, a government member allayed fears by drawing attention to clause 3 of the bill. What this says is here, and I would like you to read this carefully, the mere discovery of a new form of new substance, which does not result in the enhancement of the known efficacy of that substance, or the mere discovery of any new property or new use for known substance, etc., unless such known process results in a new product or inflow, at least one new entity. There is one word which appears here, which is called discovery. And then it says the mere discovery. This word, this phrase, mere discovery, is there in the bill which was passed by Parliament. Supreme Court, and I'm going to come back to that phrase, mere discovery. Supreme Court then on the Parliament debate, and this is the one time I think a Supreme Court judgment has really complimented Parliament and has complimented the executive also. I think as Indians one should be proud that there are times in our democracy when the three arms of democracy, the executive, the legislature, and the judiciary, all appear to be working together to actually produce something. And this was how the bill was introduced, and the court says the bill evoked a highly insightful and informed debate on the subject. To anyone going through the debate on the bill, Parliament would appear keenly alive to national interest, human rights consideration, and the role of India as the producer and supplier of drugs. So I think this is a compliment which I thought I would put up, because as we head into a general election, the impressions of the last Parliament are in fact not very good. Of course, I do not know which members of Parliament said what in this debate, because I have not gone back and done that homework. Now it turns out that I won't read all of this, but what this section does is it defines what are not inventions, and it says the mere discovery. I want you to see only two words here. In the Act as passed by Parliament, there are two words: invention and discovery. Now, of course, the question would be, what do these words invention and discovery really mean for scientists? And since we are in the Bangalore Science Forum, what is it that the scientists would like to do? You would either like to invent something, or you would like to discover something. And here, both Parliament and the Supreme Court now appear to be defining the words invention and discovery in a way which might sometimes make one uncomfortable. Now, this is the judgment. This is the final judgment. The claim for the patent for beta crystalline form of imatinib mesylate would only appear as an attempt to obtain patent for imatinib mesylate, which would otherwise not be permissible in this country. So they dismissed this patient because what the company is trying to do, if you have a patent which has expired somewhere else and you want to continue it, you have a strategy which is called evergreening. So your patent can remain evergreen by small modifications, where you don't spend much money making a modification, but then you have new patents which prevents competitors and which keeps prices up at an artificial. Now I come to the second part of my talk, and I'll go through this quickly. Are there any lessons to be learned from the Glivec story? For scientists in India, there are some lessons to be learned from the Glivec story. If we are to even carry out a fraction of the science which lies behind Glivec, we need to do more research. Even more importantly, we need to do more interdisciplinary research, and we need to do more medical research. Medical research is more or less non-existent, and the interface between medical research and science and engineering research on the other side is also non-existent. These are interfaces which need to be created. But in order to do this, one needs to motivate everybody. You need to motivate science administrators, you need to motivate researchers, teachers, and students to understand the problem. So I thought the Bangalore Science Forum would be the best place to try and to explain what are the lessons that we should learn, and what are the lessons that other people have done in some wonderful research which has been carried out. What kinds of disease can one address? They can address diseases which are metabolic, genetic, or environmental in origin. These are what I would call a failure of biology. Biology is pretty good, but still biology will fail at some time or the other. Diabetes, heart disease, cancer, and neurodegenerative disease are, of course, problems of biology. Of course, we can also say that we can't be immortal, because if we were immortal, there would be lots of other problems. There would be the problems of population and all the other problems which go with it. There are also infections which come from outside: bacterial, viral, fungal, and parasitic. So you can have, for example, tuberculosis, you can have influenza, you can have candidiasis, for instance, or you can have a disease like malaria. What you need for evaluating the pharmaceutical usefulness of a molecule is you need to be able to test activity on infected animal models. I'll show you an example. You need to be able to test activity on cells. This is how antibiotics were discovered. You need cell-based assays. This is how cardiovascular medicines were discovered. And you need molecular targets. This is how Glivec was discovered. Now we come back to the problem of invention versus discovery. Now, Mr. Gopal Subramaniam, a former Solicitor General of India, argued the case on behalf of Novartis. He lost the case, but he made some very good arguments. And he submitted, the Supreme Court says, that by definition, a trifling change of the words of the section, a mere discovery. And what he says is, an invention cannot be characterized by the word mere. The word invention is distinct from the word discovery. The Supreme Court did not buy Gopal Subramaniam's argument because the Novartis problem was not an invention. It was just a way of trying to go around, circumvent the law. On the other hand, what is an invention and what is a discovery? Now in India we have three words, actually the word which is most widely used is the word innovation. Even the state of Karnataka has an innovation council, and the Prime Minister has an innovation advisor, and the UGC now wants to make innovation universities. Now of course innovation cannot be legislated, innovation must happen, and it's only people who are innovative. And so here discovery would be Fleming's discovery of penicillin. Invention might be applied to Edison's invention of the light bulb or illumination, or even to Einstein's invention of relativity as a way, it was an invention of the human mind, as a way of explaining natural phenomena. Innovation will be something as trivial as the retail store, which we all know, and now malls and so forth, which are also innovations in business practices. But let's go back to drug discovery. Drug discovery can happen in two ways. Serendipitous, which is accidental. Fleming is a classic case. This is a historical picture of Fleming's Petri plate. He was a very shabby worker, so he allowed, if he was clean, he would never have discovered penicillin. He allowed his bacterial plates to be contaminated with the mold, the fungus. This is just the kind of thing which grows on bread or something if you moisten it and leave it. It also will grow, if you want to try this experiment, on Shika powder, which is used for cleaning hair after a bath with oil. If you make it a little bit wet and leave it and don't do anything, after a while you will find the white fungus growing over it. But this fungus now produces a molecule which now keeps the bacteria from growing. So it's produced an antibiotic. That antibiotic is penicillin. So the era of antibiotics began with this accidental discovery. Today we would do it by design, biological target identification, as I showed you for Glivec. Rational design was creating large numbers of molecules. The first anti-tuberculosis drug appeared in the late 1940s, early 1950s. This is the Streptococcus, which produces the organism. This is a Selman-Waxman who received the Nobel Prize for finding streptomycin. Very interesting stories about streptomycin which have come afterwards. It turns out that the young man that you see in the corner died a short while ago, Albert Schatz, was a graduate student then working. He's the one who actually discovered streptomycin. Waxman never even came to the laboratory to see this, but after streptomycin became a major discovery, Schatz was forgotten. Waxman was given the Nobel Prize and became a very, very influential scientist. Nobody listened to Schwartz till the 1990s. And in the 1990s, two books appeared, data appeared, lab notebooks appeared, historical material appeared, and unfortunately, poor Schatz never really received the credit that he deserved. But you can see that molecule, Fleming's molecule, came from nature. The anti-tuberculosis drug streptomycin came from nature, not from chemistry. It came from nature's chemistry. There's a third. This is another fungus, Penicillium, Citrinium here, which was discovered by Akira Endo some years ago. He was working on this. He found these molecules, which are in fact the precursors of the statins. When he first got the first molecule, he saw that he looked at the structure and he recognized that this part of the molecule looked like this part of the molecule, and therefore this part of the molecule is used by a machine like this, a molecular machine, So he investigated this further. It becomes an inhibitor, just as Gleevec is an inhibitor of the enzyme which transfers phosphate groups to kinases. The statins are inhibitors of this enzyme called HMG-CoA reductase, which is involved in the biosynthesis of cholesterol. All these are cholesterol. The statins are cholesterol-lowering drugs, and I would suspect there are some of you who are in fact taking the statins without worrying about it too much. But they also come from nature, and these were discovered between 1971 and 1987. But I'll show you one more natural molecule which was discovered, the anti-malarial artemisinin, which is now used when malaria is drug-resistant, chloroquine-resistant malaria, which is now spread in some parts of India and also all over Southeast Asia, requires artemisinin. This was discovered by the Chinese, discovered under very interesting circumstances during the Cultural Revolution of the 1960s. When Mao Zedong was in power, the Cultural Revolution was there. He sent away all the scientists to do work in the fields and kept a few scientists to work on targeted projects. The Chinese army was interested in anti-malarials because they were worried that they would have to interfere in Vietnam, which was becoming a greater and greater problem with the American war in Vietnam. And as a result, anti-malarials, because malaria was absolutely widespread in those jungles, anti-malarials were very important. They did this the brutal way. They had an animal model, they infected the animal model with malaria, and then they screened plant extracts of all the possible plants which the ancient literature had suggested had anti-malarial properties. You must of course remember that quinine, which is the first anti-malarial, itself comes from the fact that Jesuit priests, when they went to South America first, would get malaria. But they found that the South American Indians were in fact chewing the bark of the tree, of the cinchona tree, which produces quinine. And then the alkaloid quinine was isolated. So historically, there are anecdotal Ayurveda, all traditional medicines have anecdotal natural remedies. But from these natural remedies come real molecules which are now nature's molecules. I should go back one step to tell you something that I forgot to read for you, but you should read what Sir Watson said in his local lecture. Even though he didn't he recognized something, he must have been a religious man because he quotes the scriptures where he says, "The Lord hath created medicines out of the earth, and he that is wise will not overcome." What this means is that all the organisms from which you're getting antibiotics, all the fungi and bacteria, they're all living in the soil. You culture them from the soil and then you isolate molecules from them. But what Dr. Yu too, who led this exercise, she's now in mid or late 80s. She was discovered a few years ago and the Americans gave her an award after all these years, the Lasker Award. And she says that it came from reading the old, how did they do this? They had extracted this plant, they got a decoction, but the decoction did not work on the malaria-infected mice. Why did it not work? Because they had extracted it the way chemists will extract anything. They will boil. Just the way you extract tea from the tea leaves. But if you go back to the old Chinese literature, it turns out what it says in translation is that a handful of this plant emerges with 2 liters of water, bring out the juice and drink it all. So what you have to do now is not extract hot, but squeeze it cold. Because if you extract it hot, the molecule is destroyed. Many years later, when the structure of artemisinin was established, it turns out that it had this unique linkage. Those of you who may remember high school chemistry will remember that if you have HO and H, it is water, H2O. But if you have HOO and H, it is hydrogen peroxide. And hydrogen peroxide is not something that everybody likes. But if you have other peroxides, they're all explosives. So this is a very explosive molecule, and it doesn't really explode, but decomposes when you heat it. But you can learn a great deal from the old literature. Now, of course, plant drugs are being looked at quite extensively. You can see all the kinds of molecules which have come from plants. There are molecules which people, this is the 2012 review in Science, so there has been a return to plants and microorganisms in order to find molecules from nature. And I'll show you just one example. This molecule on the right here is a very recent paper which suggests that this is a non-opioid analgesic. It does exactly what morphine does, but it's non-addictive. So there's great hope of developing non-addictive analgesics by following this lead. Effectively, what this means is that chemists should revisit the chemistry of natural products, because molecules are produced by microorganisms, plants, and animals. And a long time ago, in our textbooks, they were categorized as secondary metabolites. And the word secondary immediately says that they were not important. But I must read you this. Secondary metabolism represents the splendid idiosyncratic diversity of nature, endowing different species with specific solutions to biological problems. The large number of molecules which exist in nature which can be screened. Now we have discovered also in recent years that molecules in nature, the way they are made in not a very precise way. By not making them in a very precise way, large numbers of similar molecules cannot be made because selectivity is not there, and therefore you now have a library. Today, biologists and chemists use the word library a lot. Just like you go into the library and search for a good book, you need a mechanism of searching to find a good book. How do you find a good book? Somebody tells you. Either the review, the publisher, or a friend. Now if you have a library of molecules, you can screen all these molecules in a set of biological assays and find out which molecules are good. Today there are two classes of medically significant drugs. Natural products, all these are in use today, or synthetic molecules. Now, if you look at these, you will find natural molecules are more complex, synthetic molecules are simpler. But natural molecules are never made, even though Dr. Ramana said that I worked on the synthesis of erythromycin. No chemist will make erythromycin cheaper than the microorganism. So it is much better to go the microbiological route of fermentation, growing up large cultures, and using biochemical engineering to scale up. On the other hand, if the molecules are simpler, they will go by the methods of chemistry rather than by the methods of microbiology. But the one thing that I want the students to understand here is chemistry and microbiology are linked, but they are linked together by biochemistry in between. And therefore, all these subjects eventually feed into medicine. And the techniques by which you determine all these structures and so on come from physics. So there is, and as we deal with larger and larger numbers of targets, molecules, libraries, and so forth, one of the most important subjects has become computer science, because there needs to be a way of handling all this information in a sensible way. And the information is becoming harder and harder. I'm going to conclude now by telling you the last time a major Nobel Prize was given for work done in the pharmaceutical industry was when Nobel Prize was given to James Black and a couple of his colleagues in the 1980s. They discovered the beta blockers and many other drugs which you take for ulcers. All the older people, I don't know how many people are taking beta blockers now. Everybody takes beta blockers without knowing that they're beta blockers. The large number of uses of beta blockers. But the first one was discovered using a very simple principle. He called these drugs from emasculated hormones. And he said the principles of synaptic antagonism. Hormones are molecules by which one cell of your body is signaling to another. Now, when you look at those athletes, 100 meters, you have Usain Bolt in the last 10 meters trying to keep his nearest competitor from beating him. There's a surge of adrenaline which takes him to the finishing line. Adrenaline is this molecule. It is that surge of adrenaline which actually keeps me speaking at the end of a long day of bureaucracy and things. Now that surge of adrenaline means that something's going, blood flowing through, things are expanded. So cells are signaling. Now sometimes you might like more blood to flow, sometimes you might like less blood to flow. especially now if you're having palpitations and so on, you would like to dampen them a little bit. And that, so when you deal with hormones, there are two words, agonists and antagonists, which the pharmacologists use. And that's what he uses. He was a pharmacologist. But he was such an enlightened pharmacologist that he was able to lead drug discovery teams which produced drug after drug in the 1960s. The real revolution in pharmaceutical industry happened at that time. This is a beta blocker. You can go back and see propranolol, and you might in fact find that you or some of your relatives are in fact taking it as an old drug. What does he say? What were the assays that Black used at that time? He used classical pharmacology, and where he used either tissues or occasionally a measurement on an intact animal. Like when you go and get ECG done, it's a measurement which is made on you. ECGs will look somewhat like that, and what is measuring here is actually the heart rate. And then you, and then really what he said as analytical pharmacologists, what we are allowed to see of the new molecule's properties is totally dependent on the techniques of bioassay that we use. From Black's time to today, the techniques of bioassay have improved. But this is what I think everyone should think about. The prismatic qualities in an assay distort our view in obscure ways and in degrees. Sometimes we get so carried away by our assay that a very useful molecule we don't find its use because we only use the wrong assay. He says our only defense lies in restless improvement in technique and experimental design in the hope that combination of several techniques will improve the reliability of our vision. We would make the change self-consciously today, but in the old days it was intuitive. It turns out that when it was intuitive, more drugs were discovered. Today with my own colleagues, every colleague believes that the bioassay that he uses is better than every other bioassay. Now what Black says is, we should never be satisfied with one assay, but we should be restlessly trying to improve the way in which we are trying to find the molecules. So today the search for drugs requires a large number of chemicals, it requires a large number of biochemical assays, it needs an investigation of all of these at different concentrations. Today when I say a biochemical assay, it would mean putting a target and a bullet both into one of those little beds, getting a color from it, reading it automatically, and not having just a matrix that looks like this, but having a very much larger matrix, and also spreading out into the third dimension, where they're all investigated at different concentrations, and we get a huge amount of data from this, and this of course will automatically be fed into a computer, and then there will be ways of analyzing the results that were had. This would be the kind of automatic screening to fill all of these. You no need all of us standing, but you will have robots now filling these, so they are becoming more and more automated. But in concluding, I would really like to go back to James Black, because when you think of Glivec and you think of drug discovery, you must read what he says. And yesterday, when I found this lecture and read it, I thought I must immediately decide, because the Supreme Court, Mr. Gopal, all of them worry about two things. How do we distinguish between invention and discovery? On the slide which I showed you, I have myself distinguished between invention and discovery by putting Fleming on the one hand and Edison on the other. He says, my first prejudice is about the need to distinguish between invention and discovery. He was a man focused on discovering drugs, and his drugs have helped so many people. Discovery is about exposing the mysteries of nature of what already exists. Invention is about creating something that never existed before. Then he says, discovery is the major activity in academic university research. Invention is the major preoccupation in industrial research. Discovery is about the excitement of traveling. Invention is about the satisfaction of arriving. I don't think anybody would have put the distinction between invention and discovery better than Black. I wish there had been someone to bring this to the attention of the judges of the Supreme Court. I'm sure they would have appreciated this enormously, and they would have included black, they would have quoted black in their judgment. But then, how do we go about this? How do we find people to do this? Will India ever discover drugs in a manner in which they should be discovered for the myriad problems that we have? Would we ever reach a situation where we can do what Novartis did? Although we may not like Novartis for charging us too much money for what they've done, could we have done what Novartis done? This is a question that not the government, not the court, not Parliament, not anybody is asking. This is what I think is a question that we must ask ourselves after the Glivec judgment has been delivered. What Black says, the point that I want to make is that psychologically, inventors or discoverers are different kinds of people with different needs and management. Perhaps we need the equivalent of football scouts to scour the academic research labs of frustrated individuals with ideas that they cannot get funded to do. Now, I thought this was a very, very interesting idea. It is not an idea which anybody thinks about, but there must be some way of actually being able to reach the stage where true drug discovery can actually happen in India. I must apologize for not having in this time been able to give you a slightly more technical view of the way in which drugs are actually discovered. But by trying to provide you a much broader view of the Gleevec case and using it as an example to reflect on the problem of drug discovery, I hope that some of you will go back and think about the problem of how one can in fact try and progress in areas like this. I think the solutions lie in trying to understand the magnitude of the problem. And if we do not understand the magnitude of the problem, we will in fact bury ourselves, our heads like ostriches, and not worry about the world around us. And that will only get us deeper and deeper into trouble as far as healthcare is concerned. Thank you very much.